Consider this stunning statistic. 1 in 8 women will develop invasive breast cancer during her lifetime. Little wonder so many of us make the annual trek to get a mammogram, thinking that if something is detected, surely a biopsy will determine whether it's cancer or not. But if you think a biopsy is as simple as black and white, think again, as Judy Valencia's story will show you in tonight's Nightline Investigates.
Turn your head towards.
It's not something most of us look forward to. But just like 37 million other women who get a routine mammogram every year, it was now my turn.
Hold your breath, breathe, and relax.
I was lucky enough to be at one of New York City's premier hospitals, the Mount Sinai Medical Center. It hurts a little bit. It's uncomfortable, but it feels like it's something you need to do for yourself. 700 miles away in Saginaw, Michigan, Judy Valencia has been vigilant about getting her mammograms.
My sister had breast cancer, my mother had breast cancer, and my 3 aunts also had breast cancer.
While I got good news about my mammogram, Judy wasn't so lucky.
I went for another mammogram to make sure, and then after that they sent me for a biopsy. It was very painful.
Based on that biopsy, Judy was told she had cancer.
There's nobody that questions a biopsy and gets it double checked.
Hi, Barry.
But women must get second opinions, says Dr. Elisa Port, one of the nation's leading breast surgeons who works at Mount Sinai's Dubin Breast Center. Have you ever had a woman come to you and who said, I have been diagnosed with breast cancer, and then and be ready for surgery and discover she didn't have it at all?
Absolutely. I mean, first of all, they never even get close to an operating room. But we see patients all the time. They come in with their diagnosis and their report saying breast cancer. We pass the slides off to our pathologist, who sends me back a report a day later saying, don't agree, this is not cancer, and it's very clear cut that it's not. And wow, that's probably one of the most critical pieces of information. That's why no one even gets near an operating room until those slides are reviewed.
So we're in the pathology laboratory where we process tissues that come from surgery or from biopsies.
Dr. Ira Bleiweiss is one of the country's leading breast pathologists. Ironically, Dr. Bleiweiss says that because mammograms have become so much better at detecting smaller and smaller lesions, diagnosing breast cancer can actually be more difficult these days. He showed me an example.
This is a core biopsy of what I'm certain to the radiologist was an irregular solid mass.
So this is a lump in someone's breast, but not detectable by the woman, probably.
That's correct.
No question in your mind about this one?
No, absolutely. This is an easy case.
Easy to diagnose, but all cancers are not the same. So this is a tough one.
Yes.
Why?
Because the changes are very subtle.
Every pathologist, even every trained pathologist who looked at this, might not see it the same way.
That's correct.
How often do you get presented with a slide like this one, which is really sort of iffy?
Oh, every day.
Every day?
Yeah. That's a very common occurrence in my practice.
Before you're going to perform surgery on someone, you want a better reading of that biopsy than it's just having gone to some general lab that does kidneys and gallstones.
Right. And I think it's not only the lab. How can a person who does one mastectomy a month do it as well as someone who does 10 a week? These are things that are subject to interpretation, and more expertise in making that interpretation is better.
But many local hospitals don't have specialized breast pathologists and surgeons. In 2006, one highly regarded study warned the error rate in diagnosing breast cancer could be as high as 4%, which means as many as 10,000 women each year could be misdiagnosed. Which brings us back to Judy Valencia. After her diagnosis, she was told she had 2 choices: a lumpectomy to remove the cancerous portion, or a mastectomy to remove her entire breast. Panicked because of her family history, Judy chose the most extreme course. She decided to remove both breasts, the one with cancer and the one without.
I just wanted it to be done. I didn't want to have to worry about going through this again.
As painful and as disfiguring and as radical a step as it is, at least it seems like, okay, case closed, I'm breast cancer free.
Exactly.
You were cancer free.
I was cancer free, and there was no radiation to be had or chemo, and It was great. Been a good day.
Another good day.
Judy and Richard have been married for 39 years. Richard says he supported his wife's decision to remove both breasts.
I've watched a number of her relatives pass away because of it. That's why when she discussed about having a double mastectomy that I went along with it. I'd rather have my wife here than lose her.
This is all my paperwork.
In the months that followed, Judy says she couldn't get paperwork from the hospital for her insurance, so she hired a lawyer. Her lawyer suspected something was wrong and sent Judy's original biopsy for a second opinion to Dr. Bleiweiss back at Mount Sinai. In Dr. Bleiweiss's opinion, Judy never had breast cancer.
I went to the lawyer. He said he had good news and he had bad news for me. And I said, well, give me the good news first. And he said, the good news is, he said, you are cancer-free. You have no cancer. You never had cancer. Very angry.
Because it wasn't just that you didn't have cancer, it's that you had never had cancer.
I never had cancer.
That's right. Judy had both breasts removed and was now being told she'd never had breast cancer at all. Judy's lawyer, Greg Barasnoff, says it was a mistake that should never have happened.
The pathologists at this institution had doubt about what they were looking at. When they wrote their report, they didn't have clarification. They gambled. Judy Valencia lost.
There are people who do get misdiagnosed based on someone not having that expertise to know what they're looking at. It is important to stack the odds in your favor. Putting together a team that deals with this a lot, and this is what they eat, sleep, and breathe, is taking care of patients with breast cancer or who think they might have breast cancer. That's how you stack the odds in your favor.
Judy Valencia's second opinion came too late, but she says she's now telling her story in hopes that other people will learn from her ordeal.
Well, you're going to have to live with the mistake for the rest of your life.
Nothing's the same. But I can hug my grandchildren, and I'm here, and I'm cancer-free.
Only if you're a good girl and...
The doctors at Mount Sinai say a second opinion does not have to cost a fortune. Often it's just a matter of sending your slides to an expert.